Welcome to a program featuring interviews of state and federal candidates, as well as the incumbents from districts served by Clatsop, Marion, Polk, Tillamook, and Yamhill counties. I'm Ruth McEwen, an advisory council member serving Northwest Senior and Disability Services Advisory Council. I want to welcome candidates, incumbents, and advisory council members to the 2022 Candidate Forum, which is sponsored by our Senior Advisory Council and our Disability Services Advisory Council. Northwest Senior and Disability Service is a local governmental organization that provides Medicaid, Oregon Project Independence, Older Americans Act, and grants-funded programs. The mission of the Northwest Senior and Disability Services is to promote dignity, independence, and health, honor choice, and empower people. The assistance and support we provide consumers include information and assistance, in-home and community-based services, and financial and medical help, meal sites and home-delivered meals, option counseling, adult protective services, Medicare counseling, peer mentoring, money management, as well as health and wellness programs. Because of the number of state legislative districts that our service area covers, we have invited a large number of candidates to be interviewed. Each candidate has been given information on the format used in these interviews. Each candidate will be introduced by a member of the advisory councils. Then each candidate will have the opportunity to answer questions which will be timed. That way you, the viewer, can compare apples to apples. We thank these candidates for their willingness to share their views about services for Oregon seniors and people with disabilities.
Hi, my name is Linda Crandall. I'm a member of the Senior Advisory Council at Northwest Seniors and Disability Services. Today I'm interviewing Raquel Moore Green. She is a Republican candidate for the Oregon Senate District 10. Currently, she is representing House District 19. We'll be asking Raquel questions related to seniors and people with disabilities. Welcome, Raquel. Thank you for sharing your time with us.
Good afternoon, Linda, and thank you so much for inviting me to have this discussion with you today.
Can you tell us about the votes and legislation you supported last session that directly benefited people with disabilities and seniors?
Yes, there are a few of them, Linda. The first one is Senate Bill 1548, and that added individuals who provide agency of choice services to the list of mandatory reporters of abuse. The next one was House Bill 4092, which elevated the importance of equity representation, including older Oregonians, and it sets a strategic framework for broadband investment, among other things. Then there was Senate Bill 1536, which helps renters access cooling devices and cooling spaces. And this is actually a bill that is currently active in our communities throughout the state. So those were three of the ones in the last short session that I supported.
Thank you so much. Can you tell us what you have done to advocate for OPI, Oregon Project Independence?
Well, unfortunately, in the 21 and the 22 sessions, we were unable to address OIP's expansion. And I believe that that should be the starting point for the 2023 legislature. And while the state is currently negotiating an 1115 demonstration waiver, we could submit an amendment to that in the next biennium if indeed we can move that particular item forward. I think it would be the perfect place to start.
Thank you so much. How would you prioritize funding for services to an ever-expanding senior and people with disabilities population?
Well, I think the investment of dollars is critical, and it should be a budget priority, just like we have education for our children. Additionally, it should be passed out of Ways and Means early. It shouldn't be something that is a June budget bill that comes out of Ways and Means. And our current economic forecast shows that we definitely have an increase in revenue, and some might think that that will take care of the funding. But I don't think we should be disillusioned by that. I think that inflation is hitting this population even more severely, as many of them are on fixed incomes. So in my mind, it's imperative that the funding for the services in this ever expanding population be a priority. It's also important for them to have the ability to stay in their homes. And this is where they can be best served. It's where we know that they are the most comfortable and they have the greatest potential to thrive. A quick note there, my father, towards his last, few years, it was terribly important to him to be in his home. And we knew that that was the place where he was the most comfortable and did the best. And additionally, there are actions that can be taken to alleviate some of the cost burdens, including a gas tax suspension. And we mustn't lose sight of prioritizing health and vaccine access to this population during emergency health situations either.
Thank you. What will you do on a state level so that seniors and people with disabilities have increased access to affordable housing and appropriate nutrition?
Well, as I stated earlier, I think the expansion of the OPI, would be a great place to start. But I also think it's a broader discussion, and that we need to look at reducing the barriers and the regulations to building affordable housing. And it's not just what we think of as just a home, but it's the whole continuum of care, not only a private resident, but transitional housing and acute care for our seniors. One piece of legislation, however, that would have helped seniors and failed in the 2019 session was HJR 25, which would have provided a property tax freeze for seniors. And it did die along party lines. However, this afternoon, I'm proud to announce that I'm part of an effort to bring to the ballot in 2024 a measure to freeze property taxes for seniors. And this will just be one more tool to help make it more affordable for our seniors to stay in their homes. One lesson that we learned from the pandemic is that those who have compromised health had a more difficult time surviving COVID and recovering. I believe that we should be proactive in local initiatives promoting healthy diets, exercise, and lifestyle choices. And I think the best way to do this is through our local public health departments, which truly reflect their communities. And we've got a variety of communities throughout the state, and everybody should have the ability to address those needs the way the community sees it, and it gets reflected in those initiatives. Yeah. Okay.
Thank you so much. And actually, that leads us right into the last question of what would you do as a legislature to address the behavioral health issues that have been exacerbated by isolation related to the pandemic?
Well, as Vice Chair of the House Behavioral Health Committee, there have been several pieces of legislation that I've supported and I will continue to support. And some of them that were mentioned earlier. And I just don't see this, I don't see it just as one service or one issue. It's at least a threefold approach, if not a fourfold approach. And first, I believe we need to continue to make investments in our workforce to recruit, train, and retain these professionals. We need a wide variety of professionals to provide services to our seniors and our people with disabilities. We need to ensure that they've got the proper training in relating to these populations. Secondly, we need to access support and services that are critical to this community, and that they feel safe in their communities. Because if you don't feel safe, you're not going to go out to the grocery store, you're not going to go out to the coffee shop, you're going to be hesitant to go to the park. You might not even want to use public transportation if you're not feeling safe, and that hesitation compounds that hesitancy to mix and that isolation. And one of the bills in this last short session was House Bill 4045, which provided grants to organizations for community violence prevention and intervention measures. So I think safe communities is integral to re-engaging our communities and coming out of this pandemic. And thirdly, we need to incentivize and in some instances remove barriers and restrictions to allow the private sector to innovate solutions. And let me give you one example of this. Earlier this spring, I took a tour of a local childcare provider here in South Salem. And just by fluke, they met the owners of a long-term care facility here in Salem. And they collaborated and came together with this concept of having a child care center in the long-term care facility. And, you know, these are two, and when you stop and you think about our youth, the little ones, and you think about, you know, our seniors, you know, the two ends of the bookends of what we call our life, you know, having an opportunity to interact is just going to be a beautiful thing. So like I say, these were, you know, two completely separate industries that have partnership for an intergenerational crossover, and it's going to benefit the seniors and it's going to benefit the youth. So I think that's particularly necessary coming out of this pandemic. But here again, you know, reducing some of those barriers and restrictions, you know, innovation, I think that will be a big thing moving forward.
Thank you so much. We've been visiting today with Raquel Moore Green, a Republican candidate for Senate District 10. Thank you for joining us today for this interview with Raquel Moore Green, a Republican candidate for Oregon Senate District 10. Thank you so much.
Thank you so much, Linda.
I want to thank the candidates on behalf of the members of the Senior Advisory Council and the Disability Services Advisory Council of Northwest Senior and Disability Services for attending our candidate interviews. Copies of the interviews can be checked out from Northwest Senior and Disability Services by calling 503-304-3451. Again, that number is 503-304-3451. We hope the information that has been provided will help you make informed choices when you vote. The opinions expressed here are not endorsed by Northwest Senior and Disability Services. For more information or to get connected to services provided by Northwest Senior and Disability Services, please call 1-866-206-4799. Again, that number is 1-866-206-4799. The advisory councils for Northwest Senior and Disability Services would like to thank Capital Community Media for the production of the forum. Thank you for watching.